How do nurses and clinicians access and use evidence-based best practice information? At the point of care, with Lippincott Procedures and Lippincott Advisor, software within the Lippincott Solutions suite, your staff can instantly access the latest evidence-based procedural guides and clinical decision support references at the bedside to help improve quality of care and patient outcomes. At the point of learning, Lippincott Blended Learning is designed to support the rapid deployment of content on need-to-know information that gets staff quickly trained and immediately moved on to productivity. And with Lippincott Learning, you can validate staff competency and support a culture of learning with a growing library of evidence-based, multidisciplinary content which supports CE requirements and certification review needs. At the point of reference, your staff can link from the Lippincott Solutions software to more in-depth information found in Ovid, the Joanna Briggs Institute or JBI, Lippincott journals and books, ultimately improving practice, research, and quality improvement. Now let's see Lippincott Solutions in action. A patient is admitted to the medical unit with shortness of breath and increased work of breathing. The nurse hears the physician stating the patient has chronic obstructive pulmonary disease, more often called COPD. The nurse wants to quickly look up the pathophysiology and treatment of COPD, but where can she go? Go to Lippincott Advisor at the point of care and look up COPD. The patient's chest X-ray is showing an infiltrate in the left and right lower lobes, and the physician starts the patient on antibiotics and BiPAP. He plans to transfer the patient to the progressive care unit for closer monitoring. So where can the nurse go to find out more information on BiPAP? Go to Lippincott Procedures at the point of care and look up BiPAP. The patient is transferred to the progressive care unit and is given antibiotics. But the nurse needs to increase her knowledge on COPD exacerbations secondary to pneumonia. How can she do this? To enhance her understanding and increase her lifelong learning and knowledge, as well as to earn CE credits, she turns to Lippincott Learning, featuring a growing library of over 2,000 journal articles and more than 400 interactive courses that cover 70 practice settings. However, if she wants to get a brief overview of the most important information needed on respiratory care, she can turn to Lippincott Blended Learning. For a deeper understanding of the patient's conditions and potential outcomes, where can the nurse go for an even deeper investigation? The nurse can do a search at point of reference in Ovid for COPD exacerbation, and she can search in JBI for additional resources. In the end, your patient's condition has improved and you prevented complications secondary to pneumonia and an extended hospital stay because you implemented evidence-based best practice interventions from Lippincott Solutions. Standardize care, save time, streamline workflows, and improve outcomes with Lippincott Solutions. Learn more on LippincottsSolutions.com. With Lippincott Solutions as the foundation, Wolters Kluwer provides you with the latest evidence when and where you need it, when you have to be right.